My name is Dr. Camille Cash, and I'm a board-certified plastic surgeon from Houston, Texas. I've been in private practice for 18 years. I've enjoyed using plastic surgery to help transform women's lives. So from tummy tucks to breast augmentation, breast reductions, breast lifts, breast reconstruction, that's been a major focus of my practice for many years. And I've recently incorporated more women's health to address those issues that are sometimes talked about and unspoken. And by addressing those needs, I'm able to deliver the ultimate mommy makeover for my patients. So it's exciting, and I enjoy my practice, and I'm happy to be here. So often my patients are coming to see me for plastic surgery needs, and they have often had children, or they're experiencing some changes in their body as they get a little bit older. So for me, as a plastic surgeon, mommy makeovers were a big part of my practice. But part of, I used to say that mommy makeover is a very generic term for a procedure in which I'm doing one surgery to address both the breast and the abdomen, typically at the same time, because those were the most affected parts of the body after childbirth. And then as time went on, I started to realize that the vaginal area was a significant area. I'm not an OB-GYN, so it is an area that is extremely stressed by pregnancy and childbearing. And it's become a more integral part of my practice as women are seeking not only cosmetic improvement of their vaginal tissue and their vaginal area, but also improvement in their sexual health and sexual function. And I think women have just become more comfortable with their sexual needs. And it's not just about looking on the outside, which is what I did for many years and still do, but also allowing women to, really enjoy sex. And that's a huge part of our life. And just because you're a mother doesn't mean, or a grandmother, doesn't mean that you should just give that up. So, just started blending that into the plastic surgeries that I perform, and excited to do both surgical procedures as well as non-surgical procedures to address those needs.
Cash was discussing, issues that maybe from childbirth or just age. I am an OBGYN, so obviously vaginal tissue is what I deal with every day. And so other issues like incontinence, vaginal dryness, pain with intercourse, these things that really disrupt these women's lives. And when I first went out into private practice after retiring from OB 3 years ago, I knew I wanted to take my practice in a different direction. And so I had to figure out kind of what I was going to do to really offer these women non-surgical and non-hormonal alternatives out there, because that's what people are looking for. And living in the Bible Belt, women just don't really want to talk about sex and don't want to talk about leaking urine and all these things. They think they're the only one going through this. And so I really opened up the conversation for these women to realize that they're not alone, and we're able to help these women, and again, an overall health and wellness for these women. And so, like Dr. Cash was discussing, not only do we offer some surgical options, but many non-surgical options as well, which we'll go into in a little bit.
It's very exciting for women to come in with a very sensitive issue that they don't necessarily want to admit. They don't want to talk about. They often, have had children, and they still want to feel sexy. They still want to enjoy sex. They want to be, alive, fully alive. And part of what I do as a surgeon is to recreate, restore, rejuvenate. And when you have women that have had issues with, maybe they haven't had great sex, or their orgasm is lacking, or their confidence is lacking, they're uncomfortable, or conversely, women who used to have great sex that now their body has changed and they're like, what happened? And they don't want to let that go. Or you have a patient of mine that's had, a mommy makeover, breast augmentation, tummy tuck, so they don't look like they've had children externally, but sexually they're not satisfied. And so they look great, but there's just still a piece of their life that's missing. And so it's exciting, and it's really empowering for women to come back and say, and I always say, did you test it out? Did you try that? Did you have sex that night? And their face, they'll usually blush, or their face will light up. and they'll just talk about, how my husband can't keep his hands off of me, or I feel much more confident, or I'm empowered, or if there's a patient that's in between relationships, maybe they've been married and now are divorced or widowed, and they have to, kind of venture back out into the dating scene. This gives them so much more confidence. And it's funny. I used to say that, making somebody look physically better would make their sex better. Like, okay, everybody's going to, at the end of the day, have better sex. But now really there's something I can do to help them have better sex. And it's exciting, because who doesn't want to have better sex? It makes your life complete. It makes intimacy between a husband and a wife much more deep. And I think that it really is powerful for women to feel empowered, to feel, to own their sexuality, and to, take that back and to reclaim it. So it's very exciting. I'm all about empowering women from their head to the toe. So it's awesome.
So as a gynecologist, the women are coming to me more with medical issues. Like I discussed a minute ago, the leaking of urine, the vaginal dryness, therefore causing pain with intercourse. And so they're dealing with these issues that they've been faced with for so long, whether it be after having babies or aging and losing collagen, not being on hormones. Without estrogen, our tissue suffers greatly. And so again, they're dealing with these issues that they really just thought they had to put up with, and they did not think there were options. Or a lot of times people want a non-surgical, non-hormonal option for these treatments. And so I just love that I've been able to offer these women alternatives. I was the first physician in the West Texas area to offer Aviva. I've been doing this for 3 years. This is a radio frequency device that treats the vaginal tissue both internally and externally on the vulva. And the main indications that I treat women for are urinary leaking of urine, urinary incontinence, vaginal dryness, again, pain with intercourse. We've treated over 700 women, and absolutely life-changing. These women, their marriages are saved. They can have intercourse again with their husband, whereas they had not been able to. As far as the leaking, they're able to go on car rides without having to pull over at every stop to go to the bathroom. They don't have to wear pads all the time anymore. They're able to work out with their friends and not leak when they jump and run. And it's truly, like Dr. Pash was saying, it's empowering for these women to have their lives back and to feel younger. It makes them feel sexier. They are back to the person they used to be. Their vaginal tissue is healthier. And it's just amazing what this treatment has done for my patients. I also offer the O shot, which is a platelet-rich plasma. I can go into detail later if you want me to, but basically we inject the PRP or platelet-rich plasma back into the body, into the tissue, in the vagina and the clitoris, and helps with the leaking of urine, the lubrication, sensation, orgasm. I mean, who doesn't want a better orgasm, right? So again, this has been just an amazing treatment, and the Aviva and the O-Shot together are a beautiful combination. And we also offer BioT, hormone replacement therapy, in our office as well. So that's kind of the perfect triad, I always tell my patients, and it just changes their lives, and it gives them their lives back.
Practice, I utilize a number of surgical as well as non-surgical techniques for vaginal rejuvenation. One of the greatest technologies that I've really introduced into my practice is the Aviva procedure. And so it takes vaginal rejuvenation or non-surgical vaginal rejuvenation just up a little bit more of a notch. What I do is actually use radio frequency internally, so inside the vaginal canal in the introitus, but I can also use radio frequency to perform a scarless labiaplasty. And so with a surgical labiaplasty, typically we're just addressing the labia minora. But with the Aviva procedure, I'm able to deliver radio frequency, or the heat energy, that creates collagen remodeling or tightening to both the mons pubis, the labia majora and minora, the clitoral hood, the perineal body, and the introitus. And so what that does is really allows for tightening of the entire pelvic area. It can create better orgasm, better cosmetic appearance to the tissue, better lubrication, and can address the stress urinary incontinence that women complain of after childbearing or as time goes on. So it is more of a minimally invasive procedure. It's a little bit more involved because I will inject tumescent or numbing solution into all of the tissues so that I can adequately deliver the radio frequency or the heat energy that they probe. So it'll heat up the tissues from the inside as well as from the out, outside. It's a one-time standalone procedure, typically for the external treatment. And it can replace a surgical labiaplasty. And non-surgical treatments, definitely have their advantages because instead of creating scar, which is what surgery can do, is we cut and sew and it creates some inflammation and scar, I'm creating collagen non-surgically. I'm creating tightening non-surgically, so there are no incisions. And patients pretty much are, have no downtime other than the time that they're in my office. A little bit of swelling for a number of days, but as far as getting back to all activities, driving, exercising, working, and of course, sexual intercourse, they can pretty much do that within a matter of, 24 to 48 hours.
And again, whenever I morphed my practice into just being gynecology, I knew I would have to do something else for my patients, or wanted to do something else for my patients to be able to offer them, again, alternatives. And so this is the same technology Dr. Cash was discussing as far as radio frequency heat energy. These devices are both made by InMode Aesthetics, which we absolutely love. And it's a very safe treatment. Whenever I was comparing and contrasting devices and wanting to figure out what was going to be best and safest for my patients, Votiva won hands down, because it has a temperature safety cutoff valve. So you put your settings into the device, and it never can get too hot. It heats up to where you want it to get the adequate treatment to the tissue. Cools down, heats up, cools down. So you're staying within the safe range. It's very comfortable for the patients. There is an internal treatment as well as an external treatment. And like Dr. Cash was saying, you get the neocollagenesis, or the building of new collagen, new blood vessels, new nerves. And I always tell my patients, you're truly regenerating the tissue back to like it was when you were in your 30s. And my women who are in their 60s and 70s are just beyond thrilled knowing that they're going to get their healthy tissue back and be able to go back to having intercourse like we talked about, and not having to go to the bathroom all the time, not leaking on themselves all the time. And so Votiva has just been an absolute life-saving treatment for my patients. We also add the Morpheus 8 treatment to the vulva. You can treat externally, also getting around the urethra and also inside the introitus to further tighten it. So not only does the Votiva tighten the tissue, but the Morpheus 8 can further do that as well. So they're both great together.
What I try to do is explain the technology side of it, radio frequency or RF energy. And patients have heard some of these terms thrown around, and they've heard a lot of different things. There's a lot of information out on the internet, but oftentimes patients are just confused as to what is the best technology for them. And so I try to explain radio frequency as heat energy or thermal energy. We're using a device to gently, gradually, slowly heat the tissues up to a target temperature to affect change, but that won't burn them. So the InMode devices are so intuitive. It's artificial intelligence. We're using the devices to slowly heat the temperatures. We're monitoring the temperatures to make sure that we're getting a safe, comfortable, yet effective treatment. And so when I tell patients, it's kind of like a hot stone massage. It's a little bit like the most uncomfortable or the longest pelvic exam you've had, or a weird vaginal ultrasound. But it's very, very comfortable for patients. And I explain it, when you get into a bath of hot water and you're filling the tub and the water is slowly, gradually heating, it's very comfortable. But if you were to put some scalding water in the bathtub and jump in, that would be very uncomfortable and very shocking. And so these devices are very intuitive. They're very smart. The technology is incredible. And InMode is constantly developing new technologies and exploring different options and different indications for the platform. So when you just kind of break it down to patients and explain it and why this particular device versus others, they're very open. And patients are coming to Dr. Owen and myself because, they're comfortable discussing their most intimate, embarrassing details of their life and their body. And so it's a natural conversation that, listen, I'm a mother. I have 3 children. I understand,